Let me find.
Department of surgery. Unseen, அன்புடன்
of the locals. Today, they are here to create an awareness on breast cancer, which is one of the most common cancers worldwide. While most people are aware of the causes, signs, and symptoms, and extent of damage the disease can do, still many of us forget to take proactive steps, modify our lifestyle, and put together a plan to detect the disease in its early stages. A lot of progress has been made in spreading breast cancer awareness, but still there is a long way to go. Awareness and knowledge about anything allows individuals to make informed choices, and good choices deliver desired results. At this juncture, I appreciate and congratulate all the dignitaries on the dais and the members of the Rotary for sparing their precious time for the betterment of the society. Nirmala College for Women, being the first women college in Coimbatore, is still now a standalone institution which strives hard for the upliftment of the women from the marginal section of the society through quality education. Our college is one of the premier institutions which instills a sense of social responsibility among its students along with their academic endeavors. It extends its service to the society by adopting around 9 villages near Palamalai. Sneha Positive Phases of our college is doing yeoman service to the HIV affected people. It is a privilege for our institution to join hands with a like-minded organization like this to spread an awareness on this deadly yet curable and preventable disease in women. On behalf of the Nirmala College for Women, Coimbatore, I offer my good wishes for this webinar and the resource persons and all dignitaries responsible for this event to take place. Wish you all the best. Thank you.
Thank you, ma'am. We give government to call upon respected Madam President to honor the dignitaries. Thank you, ma'am. I now call the project chairman, respected Madam Udai Madhusudan, to explain about the project and provide us with information about our first speaker, Dr. D.S. Radhika, BKNM Hospital.
Good afternoon to everyone. Valgavaludan. Our project Hope, initiated by Rotary Contour Galaxy, is for spreading the awareness of breast cancer. This is the need of the hour in India because every 4 minutes, one woman is diagnosed with breast cancer in India. Women in majority are living in society in India where braziers and body are not discussed with family and friends. So with this project Hope, an initiative by Rotary Contour Galaxy, our priority is to spread the awareness, and also we will deliver mastectomy braziers to all the women's innerwear stores and hospitals for free of cost. Our main aim is to spread as much as awareness possible to make it a convenient for women to discuss about this topic. The best way to fight this cancer is the initial stage detection. So, living in a hush-hush society where even a daughter is not able to talk to a mom, mom doesn't discuss with the daughter, it becomes very difficult to reach out to your doctors in initial stages. And even the symptoms are not, they are not aware of the symptoms. So, they reach to doctors and their care providers when it's very late. So, there is where we fail. The prevention நாங்க ஸ்டூடெண்ட்ஸ் உட்கார்ந்து என்ன பண்ணிட்டு இருக்கோம். This is a ladies related problem. So now you play a very important part. Today, this minute, now I want each and every one of you, each and every student, to promise Rotary Coimbatore Galaxy that you will go home, sit and talk to your mom. Talk to your mom and make it as an ice-breaking session today. It's secondary. At least make it an ice-breaking session to start talking about such activities. You just have to ask 3 simple things to your mom. 1, any pain or discomfort is there in the breast or nipple. 2nd, redness in the breast. 3rd, is there any difference in the size? 3 simple things. Please go today and talk to your mom. So you guys have promised me today that. That's all. If there is any symptoms, that doesn't mean that she has breast cancer. It is just go to your doctor and have a checkup done. So there might be any simple small problems overall. There's nothing to fear at all in this breast cancer. Today's science has developed so much. And one more promise I would need from you guys. We keep hearing that prevention is better than cure. Prevention is better than cure. So what it is that we can do in terms of breast cancer? As a young woman, there are few points. There are only 4 points which we need to follow to avoid this breast cancer. If it's hereditary, nothing can be done. But if it's not a hereditary, then you guys have to do this 4 very simple activities. 1, healthy eating habits, which can be started only from now, not when you're 40, 50s, only from now. Healthy eating habit, physical activities consistently every day. Sunday matu gym pona patadu. Daily small walks. Every day see to that I walk for 15 minutes or 20 minutes. Consistently physical activities. And 3rd, don't delay marriage. Already today's generation we decide to get married itself is late. So don't delay that further. 4th, avoid abortion. 5th, breastfeeding up to 1 year. So the last 2 things after you get married, please remember to avoid abortion and breastfeeding up to 1 year. So this you have to go tell your akka. If you don't have an akka, please catch hold of a cousin sister and tell them. So I believe there are 100 people here and few online. You go tell your mom, another 100 add on. You go tell your sister, another 100 add on. This is what our project Hope is spreading awareness. Thank you. And with this, let me also thank, with the kindest smile of our President, Karpagam Muthuraman ma'am, the warmest effort of Dr. Radhika, a very sincere service of Dr. Srinidhi, and a big heart of Sister Helen for having us all here, and all you enthusiastic, beautiful audience, students. Now I'm sure a mission Hope by Rotary Coimbatore Galaxy will be strengthened. With this, I welcome Dr. Radhika, Chairperson of Department of Surgery, GKNM Hospital. I very curiously asked her sometime back, just now when I met her, I very curiously asked her, what made you choose surgery? She replied with a very humble smile, surgery is the last stage of a problem. Idukapra problem illa. That is why I chose surgery. So please give a big hand of applause to Dr. Radhika, a very humble lady. Please, ma'am.
So good afternoon, everybody. I'm so happy to share this day with you all. At least, I think I go down project. Hopefully, I bring some awareness for the younger generation in preventing such bad diseases. Basically, we are exposed to all these problems only because of modernization, westernization, and partly to our attitude. See, we are an intelligent sector compared to the ancestors. They were following some norms, knowing or unknowingly about the reason for what they followed. So our elders never asked their elders why did they do this. So they didn't know the reason. When we asked our elders, why are you following this? They were not able to give an explanation. And henceforth, we stopped following all those traditional valued acts. And now we are facing a lot of problems. We are getting more of viruses, we are getting more of diseases, our immunity level is going down. Partly the increasing number of population also can be a reason for this. And everybody's life has become so mechanical. Nobody is thinking about themselves. I don't know what we are chasing, including me. I don't know what we are chasing and where we are going to stand. No one knows what is in the cards for us in future. So let us see what we can do. Have some points about this risk factors and what we are going to do with this breast cancer. Excuse me.
Sorry, students. Doctor has got a very beautiful presentation with a lot of knowledge in it, but technology always keeps you on hanging in the need of the hour. So the presentation is not opening. Sorry. We are just trying out. Ma'am, you can continue.
Yeah. So I will just continue with what I wanted to convey to you. So this month is Breast Awareness Month, October. Why do we want to celebrate a breast awareness month? Why breast cancer awareness? Why not other cancers? What is the problem basically? There has been statistically significant increase in number of breast cancers, and also the incidence of cancer. You know what is cancer, right? Cancer is abnormal reproduction of cells in a particular site which has a potential to invade to its neighboring tissues and to distant organs. So basically, this is a disease. So, so when cancer, why we celebrate breast, why we have this breast cancer awareness and all is because of the increasing incidence of breast cancers. And also, there is previously we were thinking cancers were diseases of the elderly, but now it is not so. There are cancers which can occur in children. That falls into a separate category. But breast cancers per se, which increases with age, like for example, if we are 40, if the risk is 5%, when we are 80, the risk is 20%, 25%. But now even people with under the age of between the age of 30 to 40 fall into this bad disease. Why? What is causing the problem? Any guess? Half of it, Mrs. Ujali had already told. It's basically the change in lifestyle. What happened to our lifestyle? What we did not follow from our elders? See, early to bed and early to rise was the norm earlier days. Now we are all working late, sleeping late, getting up late. The whole diurnal hormonal changes within the body has completely changed. Whatever is set for the body, it has to function in its proper timings. If you change the whole rhythm, everything gets changed. So the hormonal milieu within the body changes entirely, exposing your risks to be higher. Then next one is yesteryears people used to walk for miles to reach whatever they want. But even to the next door, we go by a two-wheeler or a car. So our mobilization, our physical activity has come to a standstill or much lower than what is required. Basically, for a healthy lifestyle, you need to have at least 150 to 300 hours of not hours, sorry, minutes of moderate activity at least every week. Or if you are into gym activity, it can be reduced to 75 to 100. At least 3 to 4 times a week it should happen. It's not just one day, and it's like having your breakfast every day or having your lunch every day. Exercise should be a part of your program every day. And we are exposed to all these cakes and ice creams, all those Western foods, which are highly saturated in sugars and saturated fats. These are all high risk factors for breast cancer to develop. So, if apart from our reduction in quality of lifestyle, we are also exposed to all these bad food stuff. I remember in my younger days, we used to have only 2 biscuits, that were Britannia milk bikkies, per day. Now you have all those creamed and flavored and so many biscuits and so many chocolates, so many cakes in different flavors. And I never remember a day where I cut a cake for my birthday in my younger days. But it happens now for every reason to eat a cake. So they are all highly saturated foods which are not good for health. They all increase the risk of developing a breast cancer in women. Breast cancer has become the first and foremost malignancy in women now in India. That's because we have started following the Western style, lifestyle now. And also our attitude. See, we are smarter than our elders at this age. When they were younger, they were just listening to whatever their elders said. In the same age, now we are much smarter. We know to question why, what, where, when, etc., for which we don't get answer from our elders. And so we don't follow what they say. At least by 50%, we don't follow. We think we know everything. And we follow the modern trend. See, my friend is following something, so I follow the same thing. We don't know the late effects of all these things. So we have to have a change in attitude. Whether you know the reason or not, you have to follow some traditional values. Next will be our yes. All these things we have to follow to reduce our risks. Apart from all this, there are some risk factors which you can avoid. There are some risk factors which you cannot avoid. The risk factors which you cannot avoid will be like hereditary factor. Supposing you have somebody in the family, like say the mother or mother's sister or grandmother had some breast malignancy, there is a 5 to 10% increase in chance of malignancy occurring in us. So this 5 to 10 percentage is unavoidable. You may get it, you may not get it. Whereas there are some factors, and also the age. As and when you age, the risk of malignancy, risk of breast cancer is going to increase. There are some factors which you can always change. They are, say for example, the lifestyle, the diet, again obesity. Obesity, you know what is obesity? Anybody? Putting on more weight, more than your normal expected BMI. So when you put on more weight, there is a lot of fat deposition in the body. What happens then? This fat deposition also causes changes in the hormonal milieu within the body. That is, there is conversion of steroids in the fat to be converted into estrogen. Estrogen is a hormone which can influence the growth of breast cancers. So more the fat, there is more peripheral conversion of steroids to estrogens. So you're getting exposed more. What happened earlier? You see, when did you get your first periods? Yesteryears they used to get it in 13 years, 14 years. But now even 9 years, 10 years, they can get their first menstrual periods. So you are exposed to estrogen much earlier. So prolonged exposure of estrogen with the early menarche and the menopausal age, which was 45 to 50, has now become 50 to 55. So the prolonged exposure of your body to more of estrogens is also a risk factor for breast cancers to develop in females. Again, your gender factor. Females are more prone to develop breast cancers, whereas males, still there is a occurrence in males, which is about 0.5 to 1% of incidence in males. Males do get breast cancer, but that incidence is comparatively very, very low. If anyone in the family has had a male breast cancer, then the chances of people inheriting that is much higher. And also, when you develop cancer, like if somebody develops a cancer at the age of 70, the prognosis is going to be good. Prognosis, I mean, is the cure with treatment or the disease-free status after treatment is going to be much better in the elderly age group. Whereas if the same cancer occurs in 30 years or 20 years, 25 years, the prognosis is going to be bad however you treat them. That is, we categorize it as 10-year disease-free survival. That's going to be much lower for people who get cancers in their younger age. Okay? And also, when you are obese, there is increased level of insulin. Increased level of insulin per se can stimulate more of estrogen production. Again, in high exposure of estrogen to the, high exposure of the body to estrogen hormone. So there is an increased risk again. And these are all the hormonal influences which you can take. Apart from this, stress values. Stress causes a lot of increase in steroid levels in the body. This steroids, again, there will be peripheral conversion of steroid hormones into estrogen, which again increases your risk factors. So these are all these things which you can avoid. And again, oral contraceptive pills. Oral contraceptive pills, if you're using it for more than 2-3 years, you have an increased incidence of breast cancer because that also contains estrogen. There are some intrauterine devices which contains the hormones for contraception. Even those expose your body to hormonal changes. They are again risk factor for development of breast cancer. So obesity and alcohol. Alcohol is another factor. Now, see, previously there were no ladies who were consuming alcohol, but now there are few people who still consume alcohol. Once in a while, maybe once a month or once in 2 weeks, nothing will happen. But if it's going to be regular, then the risk is 12-fold high. See, in Bhagavad Gita, there is a statement saying, women and children are weak-minded. When I was your age, I used to fight there is no difference between a woman and a man. I know you will have your points against it now. But in Bhagavad Gita, which was written many, many years ago, this statement is there. That is why probably the ancestors, they made a man who is elder than the woman to get married, so that they will listen to them and things happen in the right way. So when, supposing if they are true and we are weak-minded sex, if we get exposed to alcohol, you don't know when you will fall into drug dependence. So it is better to avoid tasting something rather than to get exposed and say you're strong. You don't know when you will face difficulties, when you will get depressed. The world is so mechanized. Our life is so mechanized. We don't spend time with friends and family. So we don't de-stress ourselves. So automatically when you're getting depressed, you will go in for something which gives solace to your mind. So you better avoid getting exposed to all these bad things, which increases your risk factors. So if by all this means, if you are able to avoid the disease, well and good. I am very happy. If I can bring light into some people in this hall, I am very happy. There was a famous quote in a book, Anne of Green Gables, where she has told, I am happy to have been born in a world with with October in the year. She meant it for a different reason. I mean it for a different reason. If October is a month where it can bring awareness for breast cancers, and if I am going to be part of it, I am really happy and proud of it. I want you to carry this message of avoiding risk factors to a certain extent at least, so that we all live a safe and happy life in future. So once somebody develops a breast cancer, how would they present? They can have a lump in the breast. They can have an ulcer in the breast. They can have some skin changes, like you can have. I'm sorry, my PowerPoint didn't show up, so I had a lot of pictures to show you. The skin can be pulled up at a point. That's called skin tethering. If there is a cancerous lesion, it can invade the fibrous layers which holds up to the skin, and it can cause mild tethering of the skin. That's the earliest change somebody can make out. One. Two is a lump, which may be small. And as Mrs. Ujali said, people are so shy to go to a doctor to show their breast for an examination. So they don't tend to come in the early stages. They come when almost the whole breast is replaced by the tumor tissue. So they can present with a smaller lump, bigger lump, just a skin tethering or an ulcer. They can have nipple discharge. Nipple discharge can be can occur in benign conditions also. Benign is non-cancerous. Benign conditions also. So the color and quality of the nipple discharge is important in diagnosing what pathology lies behind the breast. So like that, if there is a greenish or yellowish nipple discharge, it's more likely to be because of hormonal changes. That is not a pathological problem. And if they have a blood-stained nipple discharge, they are likely to have some growth within the breast. It may be sometimes benign, sometimes malignant. And some people can present with lump in the underarms. See, normally a cancer, when it is going to invade local tissues, you will know it when it is superficial. Some of these cancers spread to distant places through lymph and blood. You know what is lymph? If you have a toothache, you get some nerikatin solrolia, so that they are all lymph glands, lymph nodes. Like that, even breast has its lymphatic drainage that goes to the underarms. So from cancer of the breast, they can spread to the lymph nodes in the underarms, where they can present with a lump in the underarms. Or very unfortunately, very rarely, people can present with distant spread everywhere where nothing can be done. That's because we hardly spend time for ourselves. We don't get to examine ourselves. So how all these things can be, see, you shouldn't get a disease. If you get, it should, I always tell, you shouldn't get a disease. If you get, it should be something diagnosable, or it should be something treatable. There are so many conditions where we cannot get into a conclusion what it is. We shouldn't stand in that place. If we are destined to get some cancer, it should be detected early. So what helps in detection of these cancers early? For that, you should know that you have a problem. So in regard to the breast, you have to have a self-examination of the breast. If you're feeling shy or anything, okay, you can hold it as long as you don't have some problem. When you have a problem, you should turn away all the shyness and get to a doctor to get yourself treated. And so breast self-examination is one of the first and foremost method for early detection of cancer. Breast examination, how do you examine your breast? It is with the palm of the fingers, not just holding the breast like this. If you hold the breast like this, everybody will think they have a lump. It is with the palm of the fingers that you should palpate the breast. You can go around the nipple, over the nipple. You can go in all directions. And breast self-examination is better done after 5 days of your periods. Because during periods, there'll be a lot of blood flow into your breast, and there'll be a lot of changes where then your breast will be like engorged breast in a lactating breast. So you won't be able to appreciate well when you're palpating within the first few days of your periods, before and your periods. So you should actually palpate them about 5 to 6 days after your periods. Then you will get a better idea. So this breast self-examination, when you are able to pick, and also it can be done in all positions. Some positions you may not detect even if it is there. So in a sitting position, in a lying down position, with your arms raised up, all these positions you can detect a lump. You don't require any extra teaching on this. Okay. If there is anything that you can feel, you can always check in with a doctor. And see, the present trend is more tech savvy, and they have a lot of this Google with so much of medical information, which is definitely not good for you. There are a lot of information. If you read that, you will definitely feel you have a lot of information, but you don't know what to do with it. Which probably Dr. Srinidhi will be being more elaborate. So if you have some say some problems in the breast, then how are you going to investigate? What are the modalities to test a breast? First is clinical examination. Whatever you detected, you are not 100% right. So you have to get it to the doctor to check. So if the doctor feels something, then they will ask for a ultrasound or a mammogram depending on the age. In the reproductive age group, say 20 to 40 or 45, the breast will be very dense, where the mammogram will not pick up any lesions. So just an ultrasound is adequate enough for people under the age of 40. And also mammogram has high radiation. So that much of dose you need not have it in the younger age group, where it is not going to be of use. So, and mammogram is advised for people above the age of 40. Depending upon the mammogram results, and next you can go for a needle test. Needle test is a small needle prick where you aspirate a few cells or a small bit of tissue and study it by histopathological examination to get into a diagnosis of what type of tumor or cutty that is going to be. And whatever investigations you have, they are not 100% foolproof. Say ultrasound or mammogram, it is operator dependent. What I have studied only I will know. If I am doing the ultrasound, with which I may not be good about, I am not into that specialty. So even the specialists themselves have difficulty in interpreting a lot of things. So if because it is operator dependent, they are not 100% foolproof. Basically, there should be a correlation of clinical examination, radiological examination, and pathological examination. All these three things should correlate for the diagnosis to be 90 to 95% correct. Okay. So after investigating, you have different modalities of treatment. You have surgery, you have chemotherapy, you have radiotherapy, you have hormonal therapy, and last, which nobody wants, is a palliative care where you cannot do anything about the disease. These are the different modes of treatment. I don't want to scare you all of the disease. Just be aware. Don't start living with a disease that you don't have. Don't Google. Just be aware what you should look for, what you should seek for. That's all. Change your lifestyle. Reduce your risk factors. Be happy. Any doubts? You're most so welcome to. All 100% clear, eh? If there are no questions, thank you.
Thank you, ma'am. Now, we will a special welcome to our resource person, Dr. Srinidhi Nityanan. I call upon Rotary President Karpuram to deliver the gesture of welcome. I now request respectable and Kanchana Suresh to provide us a picture about our second session speaker, Dr. Srinidhi Nityanan, KMCH.
Good afternoon, everyone present here. I'm here to give a glimpse of Dr. Srinidhi Nityanan. Uh, she has done her colleges and she is born and brought up in Coimbatore. And she has done her MBBS, MD, DNB, and she is a member of National Academy of Medical Science. And she did her MBBS at PSG College, and she did her MD at St. John's College Medical College Hospital in Bangalore. And she is a consultant psychiatrist in KMCH. And her interest is in women mental health and addiction, OCD, and psychotherapy. Mm, and I warmly welcome her on behalf of all present here. Thank you.
Thank you, ma'am.
Good afternoon, everybody present here. First of all, like to thank Karpava ma'am, Jali ma'am for calling me to this event again. And thanks to principal of Nirmala College for hosting this event, because here we are going to reach to a lot of people, and like Jali ma'am pointed out, it's going to reach even further to their families, their sisters, mothers, and that's the aim of the program. And you might be wondering why I am here as a psychiatrist. Before that, I have a personal connect with this college because my mother, my aunts, everybody studied here, and I'm very happy to be here. And they were all very excited that I was coming to Nirmala College. Okay, so now coming to why mental health when we're talking about breast cancer. I think I am also very happy in the month of October because it's also World Mental Health Week, the first week of October. And health is very incomplete without mental health. So health is not just physical health, it's also mental and social well-being. So we all worry so much about physical health. That itself is so stigmatized and we hesitate to take help. So how confident are we about approaching somebody for to say that I'm not feeling well, I'm feeling mentally upset, I'm feeling very anxious? How many of us are comfortable to say that? So the stigma is even more. And when it comes to the word cancer, there is a lot of fear and anxiety associated with it because we think what we have seen in films or what we heard years back, what's being taught to us by our previous generation is cancer is deadly. So if there is cancer, we will die. So there is no hope for cancer, which is not true. we have come a long way scientifically in approaching cancers. And one of the cancer which is preventable, ma'am listed so many points about how to prevent this particular cancer. And there is also evidence to say if detected early, you might have complete cure of the cancer in breast cancer. So in that case, this fear and anxiety is what is stopping us from approaching at an earlier stage. So unfortunately, at hospitals, we see people with end-stage disease. In such a cancer which is curable at an early stage, we see people at an end stage. This is because of the fear or anxiety associated with the word cancer per se, or to approach anybody, be it they are shy, be it shy to approach, so they delay it further, and they're unfortunately at a stage where help is very minimal. So this invariably in cancers, as we are checking the person's BP, sugar, distress on the sangadam, varutham is something that we have to inquire. Because most of the time, people take it for granted. Cancer is a சந்தோஷமா இருக்க முடியும் அப்படின்னு. But who inquires about the mental health part of a person having a cancer or having some symptoms that they fear that is cancer? So cancer வந்தாலும் பயப்படணும் இல்லை. If they find out that there is something in the breast that is painful or there is some discharge, that itself they get very worried that it is cancer and they assume and அப்பவே பயம் ஆரம்பிச்சிடும். ஸோ போய் நம்ம செக் பண்ணி இதா இருக்குமோன்னு ஒரு பயம், போய் டாக்டரை பார்க்கறதுக்கு ஒரு பயம், டாக்டர் என்ன டெஸ்ட் எல்லாம் எடுத்து ரிப்போர்ட் என்ன சொல்லுவாங்கன்னு பயம், சொல்லி சரி நமக்கு இது இருக்கு ஆனா கியூரபிளா தான் இருக்கு சீக்கிரம் ட்ரீட்மெண்ட் ஆரம்பிக்கலாம்னு சொன்னா ட்ரீட்மெண்ட் எடுத்துக்கிறதுக்கு பயம், அது முடிச்சு ட்ரீட்மெண்ட் முடிஞ்சு திரும்ப சரியானதுக்கு அப்புறம் திரும்ப வந்துருமான்னு பயம். ஸோ இந்த எல்லா ஸ்டேஜ்லயும் பயம் அப்படிங்கிறது நம்மளை சுத்தி இருக்கு அந்த கேன்சருங்கிற வார்த்தைனால. ஸோ இந்த பயத்தினால நிறைய பேர் அப்ரோச் பண்ணாதனால அதனால அந்த பயத்தை பத்தி பேசுறது இந்த சமயத்துல ரொம்ப இம்பார்ட்டன்ட்னு நினைக்கிறோம். ஸோ இந்த பயம்ங்கிறது எல்லாத்துக்கும் பயம் மட்டும் இருக்கா, சில பேருக்கு என்ன நடக்குது அப்படின்னு மென்டலி புரியும், அதாவது நம்மளுக்கு கேன்சர் இருக்கு நம்ம ட்ரீட்மெண்ட் எடுக்கணும் அதெல்லாம் புரியும். ஆனா மனசளவு அதை ஏற்றுக்க முடியாது. நான் எந்த பாவமும் பண்ணல, எனக்கு ஏன் வந்துச்சு, ஐ டோன்ட் டூ எனிதிங் ராங், வை டிட் ஐ கெட், வை am I in this place? நிறைய எல்லாரும் என்னமோ பண்றாங்க பட் அவங்களுக்கு எல்லாம் வரதில்லை, எனக்கு மட்டும் ஏன் வந்துச்சு? அது எவ்வளவு பேர் வெளியில சொல்றோம் இப்படி வந்துருச்சு. இப்போ கேன்சருங்கிறது நிறைய இப்போ இருக்கிற லைஃப் ஸ்டைல்ல நிறைய பேர் வீட்டுல கண்டிப்பா வீடோ ஃப்ரெண்ட்ஸோ நம்ம கேன்சருங்கிற நம்ம ஃபேமிலியே எக்ஸ்பீரியன்ஸ் இருக்கும். ஸோ ஐதர் நம்மளுக்கு ஃபர்ஸ்ட் ஹேண்ட் எக்ஸ்பீரியன்ஸ் இல்லை வேற ஒருத்தருக்கு நம்ம ஃபேமிலியோ க்ளோஸ் ஃப்ரெண்ட்ஸ்ல இருக்கிறதுனால செகண்ட் ஹேண்ட் எக்ஸ்பீரியன்ஸ் ஆஃப் கேன்சராவது கண்டிப்பா இருக்கும் இங்க இருக்கிற ஒவ்வொருத்தருக்கும். ஸோ அந்த பர்சன் எவ்வளோ கவலையா இருக்காங்க எவ்வளோ வருத்தமா இருக்காங்க நம்ம எவ்வளோ தடவை கேட்டிருக்கோம். அதை பத்தி பேசுறதுக்கே நம்மளுக்கு சங்கடமா இருக்கு. அப்ப அது கோத்ரூ பண்றவங்களுக்கு எவ்வளவு சங்கடமா இருக்கு, அதுதான் இங்க இம்பார்ட்டண்டா நம்ம பேச வேண்டியது. ஸோ அந்த சங்கடங்கிறது எல்லாத்துக்கும் பயம் இருக்கலாம், சில பேருக்கு சங்கடம் இருக்கலாம், சில பேருக்கு ரொம்ப வருத்தம் கவலை, எல்லாத்துக்கும் டிப்ரெஷன் தான் வரணும்னு இல்லை. அது வந்து சின்ன கவலையா இருக்கலாம் பெரிய கவலையா இருக்கலாம். பட் கவலைன்னு ஒண்ணு இருக்கிறத ஃபர்ஸ்ட் நம்ம ஐடென்டிஃபை பண்ணணும், அதுதான் இருக்கிறதுலே இம்பார்ட்டன்டான விஷயம். ஸோ சில பேர் இந்த மாதிரி கேன்சர்னு தெரிஞ்சதுக்கு அப்புறம் they go through what we call griefனா துக்கம். ஸோ ஒரு விதமான ஷாக், எனக்கு இது நிஜமா வந்துருச்சா, இல்ல கோபம் எனக்கு ஏன் வந்துச்சு, இல்ல இது வராம வேற ஏதாவது வந்திருக்கலாமே, கேன்சர் இல்லாம எனக்கு வேற ஏதாவது வந்திருக்கலாமே, இல்ல அடுத்த கட்டமா சரி வந்துருச்சு இனி என்ன பண்ணுவோம் நம்ம உயிருக்கு என்ன ஆகுங்கிற டிப்ரெஷன். கடைசியா தான் அதை அக்செப்ட் பண்ணுவாங்க. இந்த ஒருத்தர் அக்செப்ட் பண்றதுக்குள்ள நிறைய ஸ்டேஜஸ் போகணும். அது சின்ன விஷயமா இருந்தாலும் சரி பெரிய விஷயமா இருந்தாலும் சரி. நான் சொல்றது கேன்சருக்கு மட்டும் இல்லை, நீங்க உங்க லைஃப்லயே நான் சொல்லும் போது உங்க மைண்ட்லயே வேற எக்ஸாம்பிள் நினைச்சுட்டா கூட போதும். ஸோ எல்லா விஷயமும் நம்மளால ஈஸியா அக்செப்ட் பண்ண முடியாது. There are various stages that we go through mentally to accept anything before we completely accept it mentally and emotionally. ஸோ அந்த மாதிரி இருக்கிறப்போ இது ஒரு பெரிய வார்த்தை அப்படின்னு நம்ம நினைச்சிட்டு இருக்கிற கேன்சரை அக்செப்ட் பண்றதுக்கும் டிஃபிகல்ட்டா இருக்கும். ஸோ இந்த அவேர்னஸ் ப்ரோக்ராம் இஸ் ஃபார் யூ ஆல் டு பி அவேர், ப்ரிவென்ட், ஏன்னா அதை பத்தி நிறைய லைஃப் ஸ்டைல் மெஷர்ஸ் எல்லாம் பேசியிருக்காங்க. ஸோ டு ப்ரிவென்ட், அப்படியே வந்தாலும் அந்த மாதிரி சந்தேகக்குரியதா ஏதாவது இருந்தாலும் சஸ்பிஷியஸ் ஏதாவது இருந்தாலும் நம்ம பயப்படாம போய் அப்ரோச் பண்றது. ஸோ இதுதான் மெயினான விஷயம். ஸோ இந்த சமயத்துல பிரெஸ்ட் கேன்சர் மேம் சொன்ன மாதிரி இது வந்து மென் அண்ட் உமன் ரெண்டு பேருக்கும் வரலாம், பட் மோர் காமன்லி வி சீ இன் உமன். ஸோ அதை பத்தி பேசும்போது உமன் சைக்காலஜி பத்தி ரொம்ப இம்பார்ட்டண்டா பேசணும். நம்ம என்னன்னா எப்பவுமே நம்ம விமன் வந்து மற்ற விஷயத்திலேயே பிஸியா இருக்காங்க, மற்றவங்களை பார்த்துக்கிறது. பிகாஸ் ஐ திங்க் ஓவர் த இயர்ஸ் women are portrayed to be nurturers and men are portrayed to be they are the hunters. So the forest la நம்ம வாழ்ந்துட்டு இருக்கப்ப men go hunt and come, women have to look after children and இது. We have come a long way from there, but still I think because this is handed over by parents, by the previous generation, we are still in that mode that only I have to take care of others. Now I think everybody becomes self-sufficient, everybody can take care of their own needs. There's nothing wrong in taking care of other people, but take care of yourself first, then you can look after the other people in the family. So your glass has to be full before you pour it into something else. So you have to be full before you want to be somebody, so your loved ones, to help them, to support them. So this is one important thing that women have to understand. So it is to help other people in the family, your dear ones. You can always be supported, but you be healthy first before you do that. So simple breast examination, self-examination is such a simple thing. So ma'am இப்போ 2 லைன்ல சொல்லிட்டாங்க. ஸோ ஒரு மாசத்துல ஒரு தடவை நம்ம பண்ணிக்கிறதுல என்ன இருக்கு? ஸோ பண்ணி நம்மளே தெரிஞ்சுக்கிறதுல என்ன இருக்கு? ஸோ இன்னமும் நம்ம இதுக்கு ஹெசிடேட் பண்ணிட்டு இருந்தோம்னா நம்ம போய் நம்ம ஹெசிடேட் பண்ணோம்னா இனி நம்ம அம்மா எல்லாம் இன்னும் ஹெசிடேட்டா இருப்பாங்க. ஸோ the more open you are about it, the previous generation will also come out of their shell and you can share the knowledge. ஸோ எவ்வளவோ நீங்க படிக்கிறது, நீங்க கத்துக்கிறது, இந்த காலத்துல பாத்துக்கிறது எல்லாமே நீங்க போய் சொல்றீங்க. இதுவும் இம்பார்ட்டன்ட். இதுவும் நீங்க போய் அவங்க கிட்ட சொல்றது ரொம்ப ரொம்ப இம்பார்ட்டன்ட். ஸோ இப்போ வந்து கேன்சர்ஸ்ல நான் சொன்னேன், இப்போ டெத் அப்படிங்கிறத தாண்டி வி கம் டு குவாலிட்டி ஆஃப் லைஃப். ஸோ ஒரு குவாலிட்டி ஆஃப் லைஃப் வந்து எப்படி இம்ப்ரூவ் பண்றது? இப்போ வாழ்வா சாவாங்கிற போராட்டத்துல இருந்து அட்லீஸ்ட் இன் breast cancers when detected early, we have come to quality of life. சரி, கேன்சர் இருக்கு, அதுக்கு ட்ரீட்மெண்ட் பண்ணிட்டோம், இது வந்து நம்மளோட வாழ்க்கை எப்படி பழைய மாதிரி கண்டினியூ ஆகுது அப்படிங்கிறது. ஸோ இப்போ breast cancersல இப்போ கேன்சர்ஸ்னாலே நம்ம ட்ரீட்மெண்ட் எடுப்போம், மெடிசன்ஸ் எடுப்போம், சில பேருக்கு breast removal சர்ஜரி நடக்கும். ஸோ அந்த மாதிரி இருந்தா அது வந்து நிறைய பேர் பெண்கள் வந்து மார்பகத்தை பிரெஸ்ட்டை வந்து அவங்களோட அடையாளமா பாக்குறாங்க. ஓ, என் பிரெஸ்ட் போயிடுச்சு, என் பெண்மை போயிடுச்சா, அந்த அளவுக்கு யோசிக்கிறாங்க. ஸோ இது ஏன் நான் இம்பார்ட்டண்டா சொல்றேன்னா, உங்க வீட்டுல யாராவது பிரெஸ்ட் கேன்சர் இருந்திருக்கலாம், அவங்களுக்கு பிரெஸ்ட் ரிமூவல் சர்ஜரி நடந்திருக்கலாம். அட்லீஸ்ட் அவங்க கிட்ட போய் நீங்க சொல்ற 2 வார்த்தை அவங்களுக்கு ஆறுதலா இருக்கலாம். ஸோ பிரெஸ்ட் ரிமூவல் சர்ஜரி நடந்ததுக்கு அப்புறம் எங்க என்னோட மேபி ஐம் நாட் உமன், மை பிரெஸ்ட் இஸ் கான், தட் இஸ் மை ஐடென்டிட்டி, ஐ லாஸ்ட் இட் அப்படின்னு நினைக்கலாம். I think even if in the crowd ஒருத்தர் போய் ஒருத்தர் சொன்னாலும் I'm very happy. So you have to tell them, ஒரு உடம்புல இருக்கிற ஒரு உறுப்புல நம்ம ஐடென்டிட்டி இல்ல. So just like we have other organs, we have the breast, and the breast is removed to save your life. Otherwise it would have spread to other regions and you might have had a serious illness. So in that way the breast is not our only identity, and we are having new developments where breast implant surgeries நடக்குது. If there are braziers where breast remove பண்ணவங்களுக்கு support பண்ற மாதிரி, so there are other options. So their self-image, part of the distress is also because அதோட treatment. So medications எல்லாம் எடுக்கும்போது hair loss இருக்கலாம், அதை பத்தி வருத்தப்படுறது. So இதெல்லாம் ஏன் சொல்றேன்னா, this is not to scare you, but if you know somebody going through this, please ask them how they are feeling. That's the least that we can do for them. How are you feeling? It is a process. The chemotherapy முடிஞ்சதுக்கு அப்புறம், treatment முடிஞ்சதுக்கு அப்புறம் they develop their hair. It's not that their hair is gone forever. So it is a temporary period, and supporting them through that is very very important. So எல்லாரும் என்ன நினைச்சுக்கோம், கீமோதெரபினா இப்படி ஆயிடும் அப்படி ஆயிடும் நினைச்சு இனிமேல் திரும்ப முடி வருங்கிறது எவ்வளவு பேருக்கு தெரியும்னு எனக்கு தெரியல. கீமோதெரபி அந்த ட்ரீட்மெண்ட் முடிஞ்சதுக்கு அப்புறம், அந்த மெடிசன்ஸ் எடுத்ததுக்கு அப்புறம் திரும்ப முடி வளரும். ஸோ நிறைய பேர் இப்போ கீமோதெரபி டாக்டர் சொல்லிட்டாங்க நீங்க அவ்வளவுதான் அப்படின்னு நினைச்சுக்கிறாங்க. ஸோ எல்லாமே பாதி விஷயம் வந்து நாலேஜ். நம்ம வந்து நம்மளே எல்லாமே தெரியும்னு நினைச்சு நம்ம டாக்டர் கூகுள்கிட்ட கேட்கறது தான் பெரிய தப்பு. ஸோ என்ன போட்டாலும் ஃபர்ஸ்ட் லைன் என்ன வரும், இப்போ தலைவலியும் போட்டு பாருங்களேன், பிரெயின் டியூமர்னு வரும். ஸோ அதனால எல்லாருக்கும் பிரெயின் டியூமர் இருக்கா? ஸோ மழையில நனைஞ்சாலும் தலைவலி வரும், 2 நாள் தூங்கலனாலும் தலைவலி வரும். பட் டாக்டர் கூகுள் ஃபர்ஸ்ட் சொல்றது பிரெயின் டியூமர். ஸோ நம்ம வந்து இருக்கிற பதட்டத்தை இன்னும் ஜாஸ்தி தான் பண்ணுறதே வழியாக அது நமக்கு எந்த சொல்யூஷனும் கொடுக்கறது இல்லை. ஸோ ரைட் இன்ஃபர்மேஷன், இப்போ நீங்க மேடம் பேசுனது ஒரு 20 minutes கேட்டிருந்தீங்கன்னா, தட் இஸ் ரைட் இன்ஃபர்மேஷன் ஃப்ரம் த ரைட் பர்சன். that is more important. But இந்த சமயத்துல இந்த டைம் ஏதாவது நம்ம என்ன நினைக்கிறோம்னா எவ்ரிதிங் அட் our fingertip. எதுக்கு போய் ஒருத்தர் பார்த்துட்டு கேட்டுட்டு அவங்க படிச்சது அவங்களே வச்சுக்கிட்டோம்னு நினைக்கிறோம். But that's not true. Right information is very, very important, and unnecessary information, overload of information is just causing more distress and trouble. So amidst all this, when we know the right information that breast cancer is preventable, that's one good news that we have. The second one is hereditary இருக்கு, நமக்கு still risk இருக்கு அப்படின்னாலும் at early stage கண்டுபிடிச்சா it is completely curable. That is another good news that we have. So இந்த மாதிரி இருக்கிறப்போ one more information that you should know is anybody going through a tough situation will have distress, varudam, sangadam. Ask about it if you know somebody in your family. And fear sometimes is good. Sometimes it's good to an extent. When it's not affecting your day-to-day life, fear is good. Because ஒன்று பார்க்குறோம், சரி இது என்னன்னு பார்த்துடலாம், கொஞ்சம் பயமா இருக்கு, போய் உடனே பார்த்து வைக்கிறதும் அந்த ஃபியர் தான். பட் அந்த ஃபியர் ஒரு லெவலுக்கு மேலே போயிடுச்சு, நம்ம போய் பார்க்க வேண்டியதே தடுத்துருச்சுன்னா then it is a problem. So even that time, if you have to take help for your mental health also, it is nothing wrong. So நம்ம கேன்சருக்கு ஸ்டிக்மா பத்தி பேசுறோம், நம்ம மென்டல் ஹெல்த் ஸ்டிக்மா பத்தி பேசினா பேசிட்டே போகலாம். So that is not the topic here. So even amidst all this, what we are trying to say is there is a lot of hope for breast cancer. So early detection, prevention, early detection, there is a lot of hope. ஏன்னா ஒரு நம்பிக்கை ஒன்று இருந்தாதான் we will go ahead, நமக்கு அடுத்தது என்ன பண்ணணும், நம்ம பண்ணணும் அப்படிங்கிறதே தோணும். ஒரு நம்பிக்கை இல்லாம இது என்னமோ ஆகட்டும் அப்படின்னு நினைச்சா we won't go to the next step. And the hopeங்கிறது வந்து is very fragile. இன்னைக்கு I can be hopeful, நாளைக்கு வந்து இல்ல அப்படின்னு பயப்படலாம். So it is changing. But on the hope, when somebody is going through by being supportive, be it your friend or family, or be it yourself, don't hesitate to go and ask for help. So this is nothing, this is, you didn't bring it on. Breast cancer is நீங்களா தேடி வரவழைச்சது இல்ல. It might be partly because of your lifestyle. அதுக்கும் நம்ம ஸ்டெப்ஸ் எடுக்கலாம், but you didn't fully bring it on. So அதனால don't hesitate to go ask for help or talk to somebody about this also. So I think we have to believe in our innate strength as humans. So COVID 1.5 வருஷத்துக்கு முன்னாடி வந்தப்போ இப்ப எல்லாம் உட்காந்து ஒரு ஹால்ல உட்காந்து பேசணும்னு நினைச்சிருக்கவே மாட்டோம். So இந்த இதோட வந்து பாதி உலகம் போயிடும்னு நினைச்சோம். Yes, there were a lot of deaths, a lot of distress. It is still not over, but we survived through that. We have survived through a lot of pandemics. We are surviving through this. So I think that way hope. இப்போ கோவிடே நம்ம என்னன்னு புரியாதப்போ தெரியாதப்போ இவ்வளோ நம்பிக்கையா ஏதோ மேனேஜ் பண்ணிட்டு இருக்கோம். பிரஸ்ட் கேன்சர் பத்தி இவ்வளோ இருக்கு, இவ்வளோ ரிசர்ச் இருக்கு, அது ப்ரிவென்ஷன் பத்தி பேசுறோம், early detection பத்தி பேசுறோம். Why not have some hope? So I think believing in our innate strength and having hope are the most important things. So that's why I chose to speak on have hope, you will hope, and I think it's very appropriate. Thank you. Any questions? This is not a class, so you can freely ask me any questions if you have. 60 years ku mela, and we won't answer.
The insurance of cancer வந்து ஜாஸ்தி ஆகும். யங்கர் ஏஜ் விட வயசு ஆக ஆக கேன்சர் ரிஸ்க் வந்து ஜாஸ்தி ஆகும். பிரஸ்ட் கேன்சர் எஸ்பெஷலி. Some of the infants, even screening one.
Screening one. My aunt got affected from breast cancer and she underwent chemotherapy. I think more than 12 chemotherapy, and she also had a breast tumor surgery. Is there any possibility to regain the cancer or it is completely cured?
The chemotherapy was before surgery or after surgery?
Before surgery.
See, you're coming in the very early stages. Surgery is the first treatment. If it is like a locally advanced disease, you give chemo, downstage the tumor, then take them up for surgery. So probably she was one of the locally advanced disease category. So varuma அப்படிங்கிறதெல்லாம் வந்து we have to.
Is there any lifespan that we can detect them, like only for?
No. See, whatever treatment you have done, how many months or years after the treatment is over now?
It's almost 2 months. Last September, she had been diagnosed with cancer. Breast
The
cancer.
treatment is over, just treatment is over. Just have to wait and watch. Because, see, if somebody comes and gets treated in stage 1 or 2, the outcome is going to be much better than for the person who has got herself treated at the stage of 3. Your aunt probably was in stage 3. So the outcome will definitely be much lesser than what 1 and 2 will have, but better than what 4 will have.
I have a question. Will regular exercise will reduce breast cancer?
Yes, I told you.
So what type of exercise? Normal. Is there any specific exercise?
Good, not specific exercise. Your full body has to be active. You exercise the arms by sitting on the chair, it doesn't help. You have to exercise your whole body. Walking is the simplest exercise for probably our age group and not for their age group. Running, jogging, aerobics, dancing.
Ma'am, thank you, ma'am. One more question. Will using of deodorant increase the chances of breast cancer?
No, deodorant does not cause breast cancer. It may cause some skin irritation, and depending on the quality of your deodorant, how much of irritation the skin is, how much of insult the skin is going to face, that much of feedback you will get then. It can end up with a small skin reaction to skin cancer. Lipstick. Basically, they're all chemicals. Whether it is specific to breast, it cannot be answered. It may, see, you can have some chemical absorption into your body, and whatever brand you have used, whatever chemical they have used, may all influence on certain things. வெத்தலை பாக்கு ஒரு மெத்தட் பார்த்தீங்களா?
Ma'am, is menstrual cycle related to breast cancer?
Yes, I said first period வந்து ஒரு 9 வயசு 10 வயசுல வந்துச்சு. மெனோபாஸ் வந்து ஒரு 55 வயசுல வருது அப்படின்னா number of years your body is exposed to the hormones. So you have an increased chance of developing a breast cancer near later age.
Later age.
Later age. அதே மாதிரி one more point I forgot because of all this lack of PowerPoint. Late pregnancies beyond the age of 30 can increase the incidence of breast cancer. Okay, கல்யாணம் ஆகிற வயசே 30 ஆயிடுது. So all have to take care of your lifestyle. Breastfeeding for more than 1 year has a definite protective effect on the development of breast cancer.
Ma'am, ma'am, you told that food habit is very important to prevent cancer. Is that intaking of more amount of soft drinks or beverages will cause any type of cancer?
You can get any type of cancer everywhere. These soft drinks are highly loaded with sugars. These sugars are not good for health. These sugars increase your insulin secretion in the body. I told you increased insulin secretion per se can induce estrogen hormone secretion, which again you can develop a breast cancer itself. You're more prone for diabetes because of this fluctuating stimulus of insulin in the body. You'll be more prone for diabetes. Again, your hormonal milieu gets changed.
Ma'am, good afternoon, ma'am. Does PCOD and PCOS have any symptoms for breast cancer? Having that in this age, will we get breast cancer after 40?
See, PCOD does not directly cause increased risk of breast cancer in individuals. PCOD எதனால வருதுன்னா because of high sugar diet, lack of mobility, increased weight gain. So இதெல்லாம் PCOD காரணம். The same things are reasons for somebody to develop breast cancer. So PCOD directly does not get related to breast cancer. It is the other factors that cause the increased risk of cancer in breast.
Thank you. Dressing style or our daily habits can cause these concerns.
What type of daily habits?
Dressing style, long dresses, size,
Food habits.
Food habits I already told you. Dressing style like braces, tight braces, loose braces, they do not influence your breast cancer. That's the problem. Food habits I already told you.
Good evening, ma'am. So I want to know if a person being cured from cancer, breast cancer, after that they lose their weight drastically. So will they able to regain that weight or the strength they have already?
They lose weight during their treatment period or
After they release.
actually after the treatment, people then take rest and eat food, healthy food, then they put on weight. If they reduce weight after treatment, then you should really check them what's wrong with them.
I do have a question. The question is that we women nowadays are exposed to a lot of stress, be it from the family or from the workspace. So, what is the intensity? I don't encourage the bad mental health, but still, what is the intensity a woman can face the stress, and what beyond results in contribution towards breast cancer?
See, stress varies in different individuals. What you might feel stressful may not be stressful for me. What I feel stressful may not be stressful for her. So it all depends upon individual mentality.
Can I add?
Yeah, right question.
Yeah, so like ma'am exactly pointed out, all of us have had different experiences in life, growing up, parenting, the situation, environment in which we grew up, the place we studied, the values that we have. So everything is so different. So we cannot, there is no one answer to this question. So if we have time one-on-one, then I can tell you how much you can, how much is your capacity and because my capacity now might be different from my capacity yesterday or day before. So it is very dynamic. So it is there is no one answer to this question. So I would say that there are a lot of other factors that have to be taken into account. So these days, stress is very easily used word. I'm in one way happy that people know that the mental health problems exist, but one way I'm concerned because I really don't know if we know the right meaning of stress when we use it. People easily say, today I feel depressed, today I feel anxious, today I'm very stressed. So do we really know the meaning of what those words mean? So even when I see people in my clinic, they say, I've been depressed for a long time. Then when I ask them and I clarify, it would be so different from what they actually mean is so different from what they say. So not using that word liberally is what I would suggest. And to be more specific on your question, it is very difficult to say unless I know other factors that how much of stress each person can endure because it is very different. And definitely stress is a risk factor for a lot of mental health problems. It can lead to mental health problems and physical health problems. By stress, what we mean is, for example, you have an exam. How we handle the difficulty is what we call stress. And stress is not always bad. So some level of stress is good. Only then we will start working towards. So if you have an exam, only if you are a little stressed will you sit and study. Otherwise, you will go for a movie. So that little stress is good. But if it goes beyond that you're not able to study, not able to focus, like some children even miss exams because they're shivering and they're sweating, they can't even answer. So that is a level of stress which causes a problem. And definitely this stress is a physical health risk also. Because when we are stressed, some people eat more. So they eat a full meal to feel happy because they're finding their own ways to feel better. So when you're stressed, you can't sleep. So that can lead to physical health problems. So definitely stress can lead to a lot of physical problems, not just cancer, but a lot. So you see obesity. So obesity can again lead to cancer. So you're again in the bush. So we're going in and around the bush. So that's why your mental health is very, very important.
And also, not many of them diagnose with stress. They don't come saying that I am stressed or depressed. Most often, they come with I have headache, I have abdomen pain, I have back pain, whatever, and you have to do unnecessary tests to say that they are organically normal.
So that is another category of people where they say, especially in our Indian population, where especially women in the rural areas, they find it so difficult to tell people at home, I'm feeling sad. So what the body mentally, knowingly or unknowingly, most of the time unconsciously does is it converts the mental problem into physical problem. There's a specific category of disorders that we call somatoform disorders, where depression is expressed as body pain. So they are not faking, they have real pain. Because there are changes in the brain that are reported because of that. There is real pain, but it is their emotional distress which is not addressed. So there is nobody to listen to when they say I'm feeling upset. So what the brain converts it into physical pain. So that is one category of people. But nowadays, more young individuals with help of Dr. Google directly come with depression and anxiety.
They come with a list of questions written on a paper. That means it is not significant. You don't remember something, it is because they remove uterus in the younger age, they give hormone replacement. Other than over a period of time, more than 10 years, if they are on hormone replacement, that increases the risk of breast cancer. But younger age, the uterus remove பண்ணா, again, there are a lot of changes, hormonal changes, where they have significant fibrocystic changes in the breast, which causes pain, which does not respond to anything. So, anyway, suggest uterus removal. Just check it with one more doctor also whether you really get it, you have to get it removed.
Yes, ma'am. I have one. Yes, ma'am. Ma'am, for a person who actually had panic attack and anxiety attacks past and have been through self-harming and such situations, if they regain their old mental health, if they are good at mental health, and in the future, is there any possibilities that they are vulnerable or easily, ma'am, easily getting into the old phase again? Is there any chances?
So again, we are talking about one particular symptom. We don't know what the underlying problem is. So we are talking about cough, but unless we know or fever, we don't know whether COVID is causing fever, typhoid is causing fever. So like that, mental health is also very broad. So if you're talking about self-harming behavior, because when you mentioned there were two, three things. So one was anxiety, one type of anxiety is panic disorder, and one is self-harming behavior. So there is always a risk that once a person makes a self-harm, there is always a risk for another one. So the most important risk factor for attempting or dying by self-harm is a previous there is a lot of other factors. So why they attempt is the most important thing. So that's why we are legally bound when a person attempts self-harm and they are at the hospital before discharge. A psychiatric evaluation has to be done to determine the risk that if a person will attempt again. But like I told you, one attempt, definitely there is a risk for another attempt. But we look at a lot of other factors to find out will the person be attempting or not.
Irregular periods
irregular periods hormonal changes வரும். But அதுக்காக whatever hormones, how much of hormones you are taking for that irregular periods, that may influence the breast cancer. Irregular periods ஏன் வருது? Lifestyle. Lifestyle. Plus some hormonal changes which are already apparent in the body. Over a period of time, it may get corrected. But if it is not getting corrected and people become anxious, திருப்பி ஒவ்வொரு cycle they start on hormone therapy. Some people என்ன பண்ணுவாங்க first ஒரு doctor கிட்ட போய் they take some hormone tablets and they are comfortable with it. They won't come for a follow-up. They continue to take it on their own. அதெல்லாம் வந்து it increase the risk.
I recently came across an article where women is being diagnosed with breast cancer, and she's also pregnant actually months, and the lactation was still suggested for her. So how far do you go to the opinion with your opinion, and how far you agree to it? Because articles are something that really important.
She got breast cancer after that she became pregnant or
She became pregnant, and
after treatment of breast cancer or
yes, ma'am. Till now she's been breastfeeding her baby, and this is being circulated all over the media. But then how far do you suggest it? Because healthy for the baby or not?
she is not on chemotherapy, she can breastfeed the patient.
Actually, she's under all kinds of treatment. But then these pictures are empowering actually, and they're boosting other women also. So as you said, it is rather to consult with a person in the field person, or to read it from some of the media, because as a youngsters you are all so much connected to the media. So as you came out with this awareness, how far do you put your opinion?
See, it is not a single drug that we give for breast cancer. It is a combination of drugs that we give as chemotherapy for breast cancer. And there are a lot of new drugs also. Some of which may not be permitted during lactation. So they might titrate the medicines accordingly. If that is the case, they may continue to breastfeed. Their oncologists would have definitely suggested to go ahead with breastfeed.
Balance, the treatment and also
They titrate the medicines as and when required.
To add on, cancer is not contagious. If that was one of the ideas in your brain, cancer is not contagious. That won't go to the baby. But what we are concerned of is the treatment given for the cancer, because baby's liver and kidney is still not fully developed like an adult. So what the mother can process, how the way the mother can process the medication, the baby cannot process. The cancer won't go to the baby, but the harm of the medications might translate to the baby. So if that was the answer you were looking for.
One year வரைக்கும் யூஸ் பண்ணோம்னா கேன்சர் டிஸ்பெக்ட் பண்ணும் அவங்களுக்கு யூஸ் பண்ணுறது பாலியல் அவங்க தான்
breast cancer cause வந்து ஒரு single cause கிடையாது. It is multiple factors put together that causes some changes in the body to develop a cancer. அது வந்து breastfeeding அப்போ மூச்சில அப்படின்னா that is not the only factor she is going to get breast cancer. There should be other factors also that play a role.
it's just that it's not avoided. Because the work
Don't avoid it.
Because the work is
Don't avoid it.
continue it.
You should know to draw a line in your life. That will reduce your stress. This much only you can do. This much you cannot step beyond that. Up to manage. You should know with your family circumstances, with your capabilities, or you should ignore something and get into something else.
Okay, final question, ma'am. Is breast cancer genetically weak?
Like I said, there's a 5 to 10% chance of
hereditary reasons for somebody to develop. And that's why I said there are two reasons where you cannot avoid the risk factor. One is heredity, that's a genetic cause. There can be a main significant gene mutation is BRCA1 and BRCA2. That is what we get. So these gene mutations can be carried on to successions. So this is one which you cannot avoid. So if you belong to the high risk group where you cannot avoid such a factor, then you have to go for early screening, and you can also get your genetic pattern tested.
Thank you.
Regular checkup is different from a genetic checkup. For high risk group, I said a regular checkup and a genetic checkup. For the other group, maybe after 40 to 45 days, you can have a screening mammogram. Clinical examination, self-examination, mammogram. See, if you come to us asking if I have a breast cancer, then I have no way other than just, I cannot say, no, you don't have a breast cancer, by just clinically examining. So I have to ask for a mammogram. And if that suggests something else, then I have to go for testing. See, one of the disadvantages of all these high-tech investigation is you tend to treat a person who may not actually going for a progress of the disease, which may be very subclinical normally. He may not even develop a lump later, but it's like the angio done for chest pain, like that. You come for a checkup and you cannot say, no, you are completely all right with all these.
Thank you, doctors. It was words of enlightenment. Gratitude is always the greatest of virtues. I just want to add on one thing, very important thing. Till this month end, Rotary Contour Galaxy is distributing free mastectomy braziers. Mastectomy is the breast removal surgery somebody has done. It could be your mom, your auntie, your neighbor, anyone whom you know. I just leave a mobile number here. Just contact us, tell us, the woman can contact us, tell their sizes, and we deliver it. These braziers are, because of this pandemic, they are not available anywhere. Even the brands who are producing it are, because of this lockdown and all that, they have not delivered to the stores. And also they are really expensive. So if you come in hand those who have this problem, we are distributing it to this market. So I'll just leave one of my number with one of your staff or whom you can connect easily. Thank you. Thank you, ma'am. Of course, this is a great gesture of kindness. Gratitude is always the greatest of virtues. It is the beginning of a new bond. I now call upon Dr. Manju Kumari, Assistant Professor and Head of Department of English Essays, to deliver the vote of thanks.
Good afternoon to all the dignitaries and the wonderful people gathered today. Nothing can be done without hope and confidence, are the words of the famous writer Helen Keller. With that hope and confidence, we all have assembled here for this breast cancer awareness program by the Rotary Coimbatore Galaxy in collaboration with Nirmala College for Women, Coimbatore. This October, which is a month for the campaign for awareness about the impact of breast cancer. You beat cancer by how you live and in the manner in which you live. Our speakers of today have created a new perspective on today's one, living with cancer and how to prevent cancer. I would like to recognize Dr. T.S. Radhika, Chairperson, Department of Surgery, GKNM Hospital, for her steadfast commitment towards the prevention of breast cancer. We have been truly inspired and motivated by our initiatives, ma'am. Thank you. I'm delighted to thank Dr. R. Srinidhi Nithyanand, Consultant Psychiatrist, KMCH Coimbatore, for the positive thoughts that mentally prepares one for fighting breast cancer and stay with hope to cope with breast cancer. Thank you, ma'am. It was a privilege to hear from our dignitaries today and to learn about their exceptional work that provided care for the underserved are examples for constructive ways to address the breast cancer challenge. Their courage in campaigning cause that is making a positive difference on behalf of women's health worldwide is truly inspiring. Thank you all special invitees. My special thanks to all those who have joined this campaign in raising awareness about the important issue breast cancer, which requires dedication, commitment, and passion. MD Rotarian Kalpagam Muthuraman, President, Rotarian Ujani Madhusudan Project Chairman, and Kanchana Suresh, Galaxy and Club President, and Lavanya Ashok, Galaxy and Club Secretary. A heartfelt thanks to all of you for making this awareness program a success. I would also like to highlight the support rendered by our Secretary, Reverend Sister Dr. Modiana Mary, our Principal, Reverend Sister Dr. Helen, our Vice Principal, Reverend Sister Dr. Mary Fabiola, for your encouragement on creating the awareness on issues pertaining to the upliftment of women in all spheres and even through this campaign, Breast Cancer Awareness. Our management strongly believes in the words, we are stronger together. Thank you, sisters. My special thanks to all our dear students for their patient listening, active participants, and making the sessions an interactive one. And my special thanks to the doctors who are patient enough to answer all their questions in a very clear manner. Thank you, doctors. Let's look forward to working for this cause and create a global awareness of breast cancer to uplift women. Thank you.
Thank you, ma'am, for your wonderful thanks. Let us all rise for national anthem.
जनगणमनाधिनायक जय भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा विंध्य हिमाचल यमुना गंगा उत्तर जगति तरंगा तव शुभ नामे जाए तव शुभ आशीष माहे गाहे तव शय